OsteoSignal Episode 20. This is OsteoSignal with Neal D O'Neal, a podcast exploring how your body's natural design connects with osteopathic science, translating complex signals into practical insights so you can truly thrive.
Welcome back to the OsteoSignal podcast, where we explore how the body heals, adapts, and regulates through the integration of structure, signal, and chemistry. Welcome to the OsteoSignal podcast. I'm Neal O'Neal, physical therapist and manual osteopathic practitioner. I'm here with Brent Mayberry. She's bringing clinical insight and application into the neuroendocrine and structural systems we explore. And Brent Mayberry.
Hey there.
Who joins us from a non-clinical perspective to help translate these concepts into real-world understanding. So thank you both for being here with me. Let's discuss the HIPAA axis, better known as the neuroendocrine axis, so that we can use that information as the basis for further discussion, as we have in previous, and will, going forward, use it in subsequent podcasts. We will refer to this axis by this name going forward. Now, because everything we're about to talk about, the neuroendocrine axis, stress physiology, pregnancy, adaptation, centers around one small structure, the hypothalamus. Okay, so this is one of those places in the body where size is completely misleading. This is a very small structure, but functionally, it's acting as a central coordination hub in the brain to interact with the body. It's constantly receiving information from the body, from the environment, from emotional and cognitive inputs, and organizes a response in real time. So if you've ever wondered how the body coordinates temperature, hormones, stress, sleep, and energy, this is where the orchestration begins. And from an OsteoSignal perspective, this is where biomechanical input, bioelectrical signaling, and biochemical regulation all converge. Makes it a very important structure that we need to be concerned with as osteopathic manual therapists. So before we build the rest of this system, we need to understand the control center. So let's step into the hypothalamus. The hypothalamus is a very small region of the brain located just beneath the thalamus, but functionally it acts as one of the body's most important coordination centers for physiology. You can think of it as a kind of a biological control hub. It is constantly receiving information from the body, signals about temperature, blood chemistry, immune activity, stress, circadian rhythms, and emotional input, and then organizing an appropriate response. So when you're on the internet,
Neal, could I ask you a quick question? How do those signals come to the hypothalamus? Is it purely through the nervous system? Is it through? I think maybe this neuroendocrine axis alludes to that. So it's both. I think it's if I understand correctly, it's both nerves and hormones, right?
Correct.
Are there other inputs that the hypothalamus receives? What about brain, like pressure in the brain, or other outside physical forces? Can that affect the hypothalamus's ability to receive signals and produce signals?
It very much can, actually, and that's where the osteopathic manual therapy comes in. So, for example, the brain is enclosed in a bag called the dura mater, and that dura mater, it's this tough covering, the tough mother, and it actually attaches to the cranial bones. And so if those cranial bones are deformed in any way and there's a twist through the system, for example, say that a patient, and of course that bag goes all the way around the spinal cord, all the way down, is attached to the sacrum at S2 and is attached to the coccyx. The S2 part is very important to us. That's why many people have probably heard of craniosacral. Well, when they say cranial, they mean the brain case, the skull, and how that bag is attached to those bones, goes all the way down the spinal column, is actually follows out for several inches on each spinal nerve. So the cervicals, thoracics, lumbars, and the sacral nerves, and the coccygeal for that matter. And it attaches at S2. So there's this rhythm of motion to pump the fluid that bathes the brain in cerebrospinal fluid. And that cerebrospinal fluid moves some proteins along, but mainly is a cleaning action, transferal action. And so signals to the brain and to the hypothalamus specifically can be directed through that pressure, because what can happen is that the pressure on that bag can alter how the neurons are able to fire. So not only do you have sensory input coming in from the periphery, whether that's proprioceptive sense, touch, pressure, temperature, or you can also have hormonal responses coming back from all sorts of structures, right? The cervix, for example, in childbearing, the the intestinal tract. People who do have an aching stomach don't feel good. Also, the vagus nerve is so your parasympathetic nervous system, specifically the vagus nerve, but all the parasympathetics, cranial nerves 3, 7, 9, 10, and the pelvic parasympathetics, S2, 3, and 4. The entire sympathetic, the fight or flight arm of the autonomic nervous system, the sympathetics that have their motor outflow from T1 to L2. However, every level of the spine has sensory input coming into the sympathetics that then go up to the hypothalamus. So yeah, you just have this broad array of information coming in. pH, there's actually electrical activity that scientists have measured, that there are electrical waves that cross the surface of the brain and ostensibly go down into the deeper structures like the hypothalamus. Those waves of electrical activity are going to affect how the hypothalamus coordinates its response to the environment and to the world. So yeah, there's lots of different ways. There are circumventricular organs that are sampling the information in the bloodstream. They're actually brain structures. They're outside the blood-brain barrier, and they're sampling the blood to tell the hypothalamus what's going on in the periphery. So there's lots of ways that information gets in there, and the hypothalamus takes all that information together and draws up a plan for how are we going to live.
Awesome. Thanks for elaborating on that. I appreciate it.
Certainly. Okay. So yeah, and so you can kind of think of the hypothalamus as a biological control hub. It is constantly receiving information from the body, signals, as we said, signals about temperature, blood chemistry, immune activity, stress, circadian rhythms, emotional input, and then organizes an appropriate, or hopefully appropriate response. But as we all know, if you get bad information in, then you get bad information out. So you get a bad motor plan or a bad body life plan if you have bad information coming in, or if there are things in the body that aren't as healthy. That's where nutrition affects how you're going to feel over the next 6 weeks. So those are all important things to understand. Now, the hypothalamus's primary way of doing things is through its connection to the pituitary gland, which is a gland which sits just below the hypothalamus. The hypothalamus releases special signaling hormones that instruct the pituitary how to regulate other endocrine organs throughout the body. So, for example, the hypothalamus releases a releasing hormone, and that tells the pituitary to release a stimulating hormone. And the stimulating hormone may go to the thyroid, adrenal, gonad, any of the lymphoid organs like the tonsils or the appendix or lymph nodes throughout the body. So we can see, like in situations like cancer or immune response, this is going to be a huge part of that. How do people live? How well are they surviving? Is there a failure to thrive? Are they able to survive, or are they able to thrive? Right. And so those are the things that we're really looking at. And that's why we're focused on this whole neuroendocrine axis, because if we can change the inputs, and the body takes in information through mechanotransduction. So a lot of your nerves transmit mechanical force, biomechanical force, into electrical signals that are giving the hypothalamus information as to what is going on in the periphery. So let's say that you have a shoulder that doesn't quite work right. There's a constant irritation and improper information going into the hypothalamus. It's going to make a poor plan. The upper extremity also, when it rotates, it actually drives the thyroid gland to not to release its hormone, but that actually drives the hormone that it's releasing into the bloodstream more appropriately. Whereas if the shoulder is stiff, you don't drain this area, you don't get thyroid, and then the hypothalamus is going to go, hey, I told the pituitary to tell the thyroid to do something, and it's not happening. So now what should we do? So you can see how important it is. Now, through this relationship with the pituitary, the hypothalamus helps coordinate several major physiological systems at once. For example, temperature regulation, maintaining the narrow range required for cellular function, energy balance, influencing hunger, satiety, and metabolic activity. And like with the GLP-1s, the Ozempics and the Mounjaros, et cetera, we can see how that communication between the periphery and the hypothalamus might be off. And so those medications are to talk to or to replace the communication system of the gut to the hypothalamus. Hormonal signaling through releasing hormones such as corticotropin releasing hormone, thyroid releasing hormone, gonadotropin releasing hormone that direct the pituitary to cause a function in other organs. Autonomic nervous system activity influences heart rate, vascular tone, and blood pressure. I know a lot of people on social media see that, tap here to make your vagus nerve do this or that. It's not the vagus nerve that's going to do anything. The vagus nerve is going to take in information, present it to the hypothalamus, and the hypothalamus will do something. And we will have a upcoming podcast about what kind of touch is the most appropriate to help give information to the hypothalamus. So this whole tapping thing where somebody's tapping in one place and expects some miracle of change in the hypothalamus. You're wearing clothes all day. If that were going to happen, you wearing clothes all day would just heal you. So that's not happening. So yeah, we'll have to have a whole discussion on that. That's not really the focus of this podcast. So, and then also like circadian rhythm and behavioral regulation that shapes sleep cycles, mood, and emotional response. All very important things. So in other words, the hypothalamus acts as a bridge between the nervous system and the endocrine system. And that's why we call it the neuroendocrine interface or the neuroendocrine axis. From an OsteoSignal's perspective, this structure sits at a critical point where the body's bioelectrical signaling, biochemical hormone regulation, and biomechanical influences all converge. When this system is functioning well, the body maintains a remarkable level of internal balance. When it becomes dysregulated, many seemingly unrelated symptoms can begin to appear. Changes in sleep, energy, metabolism, food, immune function, and stress tolerance. Right? We've all seen that sometimes, traffic doesn't bother you and other days it just drives you nuts. So yeah, you can thank your hypothalamus or, hey, give your hypothalamus a break.
Yes.
Okay. Right. Now, understanding this small but powerful structure helps make sense of why the neuroendocrine axis is so central to the body's ability to adapt, to survive, and to ultimately thrive. So let's talk about the pituitary gland, the relay station. Okay, so now that we've clarified the role of the hypothalamus, the next structure in this signaling chain is the pituitary gland. If the hypothalamus acts as the command center, the pituitary functions more like a relay station, taking those neurological signals and translating them into hormonal instructions that travel throughout the body. So a fluid nerve, if you will, that acts over time. So very useful. The pituitary sits just below the brain, housed within a small bony cavity called the sella turcica of the sphenoid bone. Now, the sphenoid bone is behind your eyes and off to your temples as well. And it basically sits there and gently rocks, which would help drive the fluid of the pituitary gland.
Or should rock, right, Neal?
Well, it should rock. Yeah, exactly. I mean, and that's
We
part of
find
it.
them all the time that don't.
Right, exactly. Or they it doesn't rock evenly, like it's not able to flex and extend evenly, so it's off in some way, and that causes all sorts of problems. In fact, in the dental world, you see that the dentists are really aware of this off kilter aspect of the sphenoid, and they will break bones and replace them so that the teeth come in even. Now, what we do, and the younger that we can get to a patient, the more effective it is. Obviously, before 7 or 8 is the best. But we try and realign those bones and take out why that bone is not moving evenly on both sides. And so that would improve the function of the pituitary gland and how well it is able to provide its chemical signal. So the pituitary is connected to the hypothalamus by a small structure called the pituitary stalk, just a couple little tubes, which contains both nerve fibers and blood vessels that transmit regulatory signals. Through this connection, the hypothalamus releases signaling molecules that either stimulate or inhibit pituitary hormone release. The pituitary then sends those signals downstream to other organs, to other endocrine organs. For example, it releases adrenocorticotropin hormone to stimulate the adrenal glands and regulate stress physiology. It releases thyroid stimulating hormone to control thyroid metabolism. It releases luteinizing hormone and follicular stimulating hormone to regulate reproductive function in both males and females, not just ladies. So it's very important to understand the menstrual cycle. The whole menstrual cycle is determined by, ultimately, the hypothalamus and the pituitary gland. Through the luteinizing hormone, follicular stimulating hormone, and from its posterior portion, it releases oxytocin and vasopressin, which influence social bonding, fluid balance, and vascular tone. All very important. So obviously that's going to work with several other systems. And immediately, one of the first things that comes to mind is that's going to work with the kidney to make fluid balances appropriate and blood pressure appropriate. So in people with blood pressure problems, you have to look at the brain and the skull as much as you look at the diaphragm, kidney, and thoracic cage. Okay, so in other words, the pituitary converts neural information into hormonal action. From an osteopathic perspective, it's also worth recognizing that this gland sits within a mechanically sensitive environment. The pituitary is surrounded by the dura mater and is intimately associated with the cranial base, particularly the sphenoid bone. Changes in cranial
Hey
tension.
Neal, could you maybe just could you point out where that bone is located? Where is the sphenoid?
Yeah.
Is it kind
So
of in
again, yeah. So the sphenoid's more in the front. It's the one that drives your sinuses.
Okay.
Right. So it's in between the eyes, kind of deeper on either side of the nose. You can actually put your fingers on that structure. On the sides, right where you're just to your temples, just behind the eyebrow ridge, you can actually touch that bone. It's there, and it so it's this little it's a wing shaped thing that it looks a little bit like this, and it's supposed to rock anterior and posterior like that.
So
so it's actually
kind of rock front and back, kind of like
rock
that.
front to back, because the occiput, which is its kind of its mate, what we call the base of the skull, those two bones are supposed to rock, in opposition to each other, which stretches that dura mater, and that's what creates a flow in the cerebral spinal fluid, and that's where exactly. So you get this fluid drive that then actually is driven to leak out of the olfactory area there, right? So supposed to leak down through your upper respiratory system and then flow into all the upper body's structures and drives health. So the pituitary is surrounded by the dura mater and is intimately associated with the cranial base, as we were just saying, particularly the sphenoid bone. Changes in cranial tension patterns, dural strain, or vascular dynamics in this region can influence the environment in which the relay system operates. And again, back to that, how does the neck work? How does the upper thorax work? How easy is it for blood to transit this area?
Sorry, that's our doorbell.
We'll cut that out.
Yeah,
that's okay.
Ruby's getting
so
it.
You might have to go back and say that sentence again, and I'll cut it out. Yeah. So.
Okay. I'll start back here.
Yeah. Hold on. Okay.
So from an osteopathic perspective, it's also worth recognizing that this gland sits within a mechanically sensitive environment. The pituitary is surrounded by the dura mater and is intimately associated with the cranial base, particularly the sphenoid bone, the bone we were just talking about. So changes in cranial tension patterns, dural strain, so if that bag around the brain and spinal cord has strain in it, such as scoliosis or a change in the shape of the bones of the skull, though that can also be caused by chewing. Some people chew repetitively on one side, and that actually twists the skull, which would put pressure into the entire structure of the brain, right? Or vascular dynamics in this region can influence the environment in which this relay system operates. So for example, the internal carotids go up the front of the neck. So people that have that forward head posture from working on computers all the time, or people that have really stiff cervical spines, the vertebral artery that goes up to the base of the brain comes inside the bones on the side, right up until the base of the skull. Then it takes a little tortuous curve around and up into the brainstem, and those four arteries come together to cause what we call to form what we call this is the circle of Willis. It's most everyone has a complete circle of Willis, but there's some variation. So it's a circle of arterial flow at the base of the brain that feeds the brain, so that if there's a blockage anywhere, that blood can still make it around and feed the area. Of course, people who've had a stroke, they've gotten a blockage somewhere and something's gotten tied up there. So this change in this shift in the position of the skull bones and the torsion or the torque or the stretch on the dura mater will actually cause those arteries to open or close more or less mechanically. So again, back to the beginning where we were talking about what are the things that can really affect that hypothalamus. That twist in that dura mater can really affect the hypothalamus because it can affect it at a blood flow level. Well, that's not always really good. Sometimes. And again, back to osteopathic manual therapy, that's one of the things that we do is understanding that, look, what if somebody has a pelvic dysfunction, their sacrum doesn't move correctly, that twists that bag going all the way up into the skull and may actually put pressure on a brain structure, causing that person to have an inability to properly react to stress or have that extra space to handle stressors in their life and not overreact to them, right? So that's definitely one of the things that we do. And kind of sounds a little fantastical, but it's just biomechanics, the bioelectrics, and the biochemical aspect of that.
So I think you just hinted at some of the effects that you can see when things aren't working properly? What are some other maybe symptoms that tell you, oh, there might be something going on with the hypothalamus or pituitary gland, as it relates to osteopathic manual therapy? Does that make sense?
Yeah.
So you said the inability, a lessened ability to handle stressors in life. Are there other things that you see in your practice that maybe indicate that, oh, I might need to take a look and see what we can do to help that cerebral spinal fluid flow properly? Or does that make sense? Besides structural anomalies that you can see, because you're really good at picking those out, are there other things that catch your eye when it comes to helping a person when get regular, I don't know what I'm trying to say, but just help a person thrive, I guess, when it comes to
Right.
the
Restore them to
neuroendocrine axis? Yeah.
normal function. Yeah.
Yeah.
The function that I think we're all trying to, to live in a society and to be able to handle the stressors and to not only survive, but to thrive is what you're saying. Is like, how do you pick out where someone's not thriving? And certainly when you see overt pathology, thyroid, adrenal, or gonadal. There are so many people that are on they're on thyroid support, or they have to do something to kill back the thyroid and then be on thyroid support. Cortisol levels, right? There's stress factors, things like that. Their fatigue. So you'll pick out all these symptoms that the person will come in. Mood changes, ability to focus, but also just changes in their thyroid function. So, how inflamed are they? How well does their gastrointestinal system work? Is there good feedback there to make that system optimal, or are there big problems going on there? Any autoimmune changes you'll see. So aside from just biomechanical things, you will see the biochemical and the bioelectrical aspects of that, right? And that biochemical adrenal problems, and there's a lot of contention in the medical world going, oh, we don't believe in adrenal insufficiency, but how about we called it adrenal lack of responsiveness to the demands? Either the adrenal gland can't stop its reaction, right? So then your reactivity is way too high, or it's become a circuit that just won't turn on. And I'll use as an example of this. In a diabetic, when they start having, in everybody, when you start having a low blood sugar, there's a reflex between your liver and your adrenal gland that as your blood sugar goes lower, the liver will send out this signal and the adrenal gland will go, oh my gosh, this is a fight or flight moment. Let's up the glucose levels in the body. And that reflex occurs and we've all been hangry and kind of going, oh, I think I'm having a low blood sugar. But in a pathological situation, let's call it a type 1 diabetic, where their blood sugars constantly go low and they have to do something to drive them up. What happens is that reflex of the adrenal gland denudes over time. And they will at some point, and that's one of the big fears for the doctor with their patient of a type 1 diabetic, is they don't want them to die of a low blood sugar because they become more and more tolerant of it, or more and more tolerant, or we could say that the reflex denudes, that the reflex stops getting set off because the body goes, oh, it's only an 80 blood sugar, no problem. Oh, it's only a 70 blood sugar, no problem. Oh, it's only a 40 blood sugar, no problem. Well, now we're getting to the area where this person cannot function whatsoever. It's not easy to get, go to the refrigerator and get some juice at a 40. So you see that, and you see this denuding. So the same thing with the adrenal glands in other situations. So this adrenal insufficiency, it's maybe not that it's insufficient for the task, but that it can't get the signal to do its job appropriately because that reflex denudes. And that's really dependent upon the hypothalamus being able to oversee that, because, and guess where that aspect comes from? It has to come ultimately from the hypothalamus. The hypothalamus oversees all of these reflexes and sensitivities. And if the hypothalamus has gotten used to low blood sugars, it won't tell the adrenal glands, go, go, go. And that's what I guess I'm talking about. And so then what can we as manual therapists do about that? We can actually make the environment around that organ, that gland, function better. But also you have to tie the hypothalamus and the spinal cord and that gland, and say, for example, in this situation, the liver back together. You have to make sure that those are more responsive to each other, and that the denuding of the reflex is restored. Right, we restore it back from being denuded. So hopefully that kind of shows, like, so where is it that we operate as osteopathic manual therapists? Now, we can't fix pathology, but there's a penumbra of problem, of dysfunction that surrounds that. So, there's the core of the sun, and then there's the outer layers of it. And we deal in the outer layers, but that deep down inside part, well, that's pathology. And there's not much we can do about that. But even from a medical standpoint, like, we give a lot of medications that deal with symptoms, the penumbra of problem around the central pathology, but we can't fix. So, for example, in kidney disease, you can't fix the kidney; it's fibrosed. That part's done. But we can improve the function of the rest of it around that, and then we, as osteopathic manual therapists, would alleviate the inflammation around the kidney that's inside the bag with the kidney, the ability of the diaphragm and the thorax to move, to naturally pump the kidney, to make sure that fluid doesn't build up in that area and then cause an increase in blood pressure inside the kidney, which kills the kidney. Right. So you can see where in my training about where osteopathic manual therapy fits into medical, the medical world of treatment, like the, adjunctive, certainly adjunctive. We're not fixing any pathology. We're not replacing kidneys for sure, but we replace a lot of, we make what's left in the organ able to function at its optimal and remove other barriers to continued degradation of that gland, if you will. So that's really where we sit. And so it's important, and that's important for patients to understand and other therapists to understand. Like, what are you guys talking about? You're talking about crazy stuff here. And it's like, well, no, it's actually very scientific. And once we have this discussion, you can really see, like, oh, there's the area we can have an effect in, and that can be a big effect, right? Autumn, you see that all the time.
Yes. I treat a lot of moms and a lot of kids. And when I know that I need to look at this HPA gonadal axis with a youth, for example, it's their behavior is off, or their learning is not optimal, or something like that. And their systems are different because they're still trying to be built and they're still trying to come together. So in that system, we're able to do these manual therapy treatments that are able to get the systems to communicate better and establish that connection at the appropriate time, or help it catch up, or remove whatever barrier might be there. And then like moms, that have just had babies, for example, if their hormones are off, that's off and off after having a baby. We kind of talked about that before, but helps them recover better. And they still might have some other issues, but a lot of those physical barriers that might be, physical, which could be electrical or chemical or biomechanical in nature, any of those, removing those helps them optimize what they have better. We already know we have in a lot of our organs, including the brain and stuff, we have lots of kind of extra that we can, if something's damaged, we can access a different part and then, or maximize, like I said, with better nutrition and stuff, because of those forces aren't there. So that's how I can tell that that axis needs to be treated with a lot of my population, is the learning, the behavior, the recovery, that kind of stuff from those kinds of things. So
I was just gonna say, it sounds like a good portion of manual therapy is helping the environment overall be able to work, as a more integrated system. Like Neal, you said, you can't necessarily fix pathology, but you can give the body the best environment to function despite, those other problems. Is that accurate?
Yeah, I think that's a great way to put it. Exactly.
Yeah.
Yeah. So yeah, and then just to follow that up, and exactly with what Autumn was saying, and your question, Brent. So once again, we see this interaction of multiple domains of physiology, right? Biomechanical structure influencing neural signaling, which then influences hormonal regulation throughout the body. Okay, that relationship becomes even more fascinating when we look at how this neuroendocrine system adapts during pregnancy, for example. And Autumn brought up pregnancy, so let's talk about that.
And does this kind of relate to that episode that we did with the placenta?
It is, yeah.
Okay, yeah. So
Yeah.
I'll in the show notes, I'll link to that episode. So if you haven't listened to that, after this you can go back and check that episode out. It was really fascinating.
Yeah, and we have several podcasts where we're going to follow that pathway of using the placenta as a means of illuminating what's going on, because there's this push-pull between the placenta and the mother's hypothalamus, and then that neuroendocrine axis, and how does the placenta deform it, and how well is the mom's hypothalamus able to take back control as needed or as able, because the placenta is very powerful. Okay, so the placenta and the expanding neuroendocrine axis. To really appreciate how powerful the neuroendocrine axis is, it helps to look at one of those one of the most extraordinary physiological events in human biology, pregnancy. During pregnancy, the neuroendocrine system doesn't simply regulate the mother's physiology. It actually expands to include a new endocrine organ, the placenta. The placenta forms from fetal tissue, but interfaces directly with the maternal circulation by embedding itself into the walls of the uterus and causing these lacunae where the mother's blood is flowing and actually, comes in contact in close approximation with the placental, comes in approximation with the placenta where the fetal blood is flowing. Okay. What makes it remarkable is that it functions not just as a nutrient exchange organ, but as an active hormonal signaling center. It produces a wide range of hormones that interact with the maternal hypothalamus and pituitary, including human chorionic gonadotropin, HCG, progesterone and estrogen, which are huge in growth, placental corticotropin releasing hormone, and various immune modulating and metabolic signaling molecules. Okay? So in effect, the placenta becomes an additional node within the neuroendocrine network, and a dynamic tension node. Okay, so the placenta communicates with the maternal brain, influences adrenal function, alters immune tolerance, helps coordinate the physiological environment necessary for fetal growth. From an OsteoSignal perspective, pregnancy demonstrates something profound about human physiology. The neuroendocrine axis is not a static system. It is an adaptive and responsive system, capable of reorganizing itself to support entirely new physiological demands. But this adaptability also means the system can be vulnerable, right? The more complex a system, the more easily it can be derailed. When signaling becomes dysregulated, whether through stress, inflammation, structural strain, or metabolic disturbance, the delicate coordination between brain, endocrine glands, and peripheral tissues can begin to break down. And that brings us back to the clinical question we face every day. How do we help restore coherence to these signals? That's where understanding the neuroendocrine axis becomes essential, not only for medicine, but for the hands-on clinical work we do in osteopathic manual therapy.
But I did want to ask you, you're using pregnancy and the placenta as an example of how this neuroendocrine axis is adaptable, right?
Yes.
And are there other circumstances where that axis adapts to a change in physiology, maybe for the better? Does that make sense?
Yeah.
I'm sure with pathology, maybe with cancer or other things, that axis will adapt in some way. But are there other ways that the axis adapts to changes in a person's body?
Lean muscle mass, right? You hear all the benefits of, you got to maintain your lean muscle mass. Exactly, because that relationship is improved with the development of lean muscle mass, cardiovascular training, meditation. And a lot of people, when they use meditation, not necessarily in a spiritual sense, certainly, but really meditation from the standpoint of a stress regulation, right? So there's another, the positive things that people do for them. There are a lot of positive stressors in life. People get married, people buy a house, people have children, and those are all very positive things. And so this neurohormonal axis adapts to those, right? I mean, people without children and people with children have very different neuroendocrine systems.
All right. Yeah. Thanks for deviating for just a minute about that. Yeah.
Yeah. Well, I mean,
so back to the placenta.
Back to the placenta. Well, and even skin-to-skin contact, which again, we're going to bring up that sort of signaling. Like, how do we access this system just as people? What are the positive things? Skin-to-skin contact that a father should, so mothers oftentimes have skin-to-skin contact with their babies, but that fathers don't always get that skin-to-skin contact as, okay, you don't really take your shirt off to hold your kid. However, that would be an important thing to do because that helps the bonding with the father and the child as well. Something important to do. Or with couples, right? We've seen through studies that women need more skin-to-skin contact. So men don't need as much. So husband
Jerks.
and wife.
No, just kidding.
Jerks. But again, that some of the real positive signaling is putting the two systems together up skin to skin so that they can kind of communicate, and that vasopressin and oxytocin will flow better. And so women need more of that skin to skin contact. And so it's important that when people are having problems in their relationship, that they get more skin to skin time, right? And that doesn't mean anything else has to be going on other than they need. I mean, holding hands counts, right? So those sorts of things. So we'll have a whole discussion about that one. That one's important, but that's a great question.
I actually have sometimes, kids get adopted,
Mhm.
and a lot of times they didn't get skin to skin with the birth mother, or even the adoptive parents don't get that as much. And I have some moms sometimes that have, and I actually learned this from you. You probably won't remember this. I remember this. An adopted boy came in. He was about 5 years old, and after he was treated by some colleagues of ours and mentors of ours, he kind of went into a corner and was kind of rocking back and forth. And you said that's where he needs to have skin to skin. And the adoptive mom was like, we don't really do that, And he was 5 years old, and she's like, and I'm not going to do it now. But then we were talking about how, I think you said this, then go to the pool and have dad hold him, and then swing him around and just do all this, like, kind of roughhouse a little bit, but hold him there, because women aren't going to probably do that with a 5-year-old boy, 5-year-old son. But dad can get away with doing that, like at the pool, roughhousing, or things like that. They can do that in great ways. So
Yeah,
and holding
even
hands with your kids. Yeah.
yeah, and even sitting on the bleachers afterwards, everyone's in swimsuits, and go up and just put your arm around them, and then, hey, you want this, you want that, talk to them, but you have that skin to skin contact going on. Yeah, no, exactly. Yeah. So I love how you pick all this stuff up and really use that in your practice. I mean, I think that's awesome. And that's the kind of things that help. It's just these little things that can be amazingly helpful to patients in, in their life and some of the problems. It's amazing how some problems just disappear after they do that. It's like, wow, okay.
With more than one person, because you're treating the whole family.
Yes.
You get those systems come back, and then you get the hormones, the oxytocin and all that stuff, and people bond better, and then communication's better. And it's amazing. It's super cool and super amazing to see.
Exactly. Well, and so there you go. I mean, so this really introduces all the concepts we're talking about the HIPAA axis and how we're going to use the placenta to illuminate that. And again, we're going to really go through what are the biomechanical, bioelectrical, and biochemical regulations of that in these other podcasts. So, maybe just to put a little more information behind that, the biochemical domain refers to the structural environment of the body, bones, fascia, fluid pressures, and the way forces move through tissues. Structure.
You just said you called that biochemical? Is that accurate?
I'm sorry.
Biomechanical.
Biomechanical.
Okay.
Thank you for that. So the biomechanical domain refers to the structural environment of the body, the bones, fascia, fluid pressures, and the way forces move through the tissue. Structure determines how circulation flows, how nerves glide, how organs move, and how pressure is distributed throughout the body. And again, that's how we as osteopathic manual therapists are going to make a change in these patients. The bioelectrical domain involves the nervous system and the electrical signaling that coordinates physiology. Neural networks regulate autonomic balance, sensory input, motor output, and the timing of physiological responses across the body. Ever wonder why the menstrual cycle starts at the least opportune time?
Yes.
That's why. Right? Well, now you know. Right?
Yes.
Exactly. And the biochemical domain includes hormones, immune mediators, metabolic signaling molecules, and the chemical messengers that ultimately shape cellular behavior. Why do you always catch a cold after you've been stressed? You're exposed to cold flu and cold particles all the time, right? And yet there are certain times you get sick, and other times not a chance. So yeah, this all feeds into this whole thing. So these three systems are not separate. They constantly influence one another. The mechanical forces affect nerve signaling. Nervous system affects hormones and alters how hormones are released. Hormones reshape tissue behavior and metabolism and growth. So metabolism and growth. The structures we've been discussing in this episode sit directly at the intersection of these domains, which is why they're so important. So the hypothalamus integrates neural signals and translates them into hormonal instructions. The pituitary gland distributes those hormonal signals to the rest of the endocrine system. And during pregnancy, the placenta temporarily becomes a powerful biochemical and immunological signaling organ that reshapes the entire regulatory network. From an osteopathic,
and it has to do that, right?
And it has to do that,
allow,
right?
To allow the fetus, the best chance for optimal growth.
Exactly, and that complex structure is really trying to balance the survival and thrival of the mother, and the survival and growth and development and thrival of the fetus, and its ability to take off on its own once it comes out after birth or during birth. So Yeah, you have one system setting off and setting up another system and hoping that it, kind of fly little birdie fly, and that's exactly it. The mother's neuroendocrine axis is going to through the placenta, and the placental's interaction are going to try and flap those wings of the baby and really get it to take off and fly, and that's and that's really how those systems interact. So it's very fascinating and is very clinically relevant. It really reveals a lot of information and a lot of it'll also allow the practitioner to see into when patients are discussing what's going on in their lives, even things that may seem trivial, right? I mean, how much information do you pick up on seemingly trivial conversations about how it's going with the kids, what do you guys want on vacation? As a practitioner, you pick up so much information in that interaction because you understand this system is in the background running, causing that health, help supporting that health, driving that health, or not. And understanding, well, where can I step into this? Where do I hear the biggest problem going on in this that I need to step in and maybe direct some interaction? So from an osteopathic perspective, this triad is where manual therapy becomes relevant. When we work with the body, improving mobility of the cranial base, restoring diaphragmatic motion, normalizing fascial tension, or improving lymphatic and vascular flow, we are influencing the biomechanical environment of the body. Changes in that environment can alter neural signaling, which in turn influences hormonal and immune regulation. So we help, for example, if the bones are under tension, since the bones are immune centers, they're lymphoid organs, if that bone can't compress and decompress, when you put, and this is why weight-bearing exercise drives deposition of calcium, right? That's part of the hormonal signaling. What if that bone's under constant tension? Well, then it doesn't compress and decompress and compress and decompress. And so that piezoelectric effect, basically electrical activity produced by the crystalline structure of the bone compressing and decompressing, that piezo effect does not occur. They do not set down bone. They also don't drive other hormones, and their immune system is not driven. So even just, working on, for example, we look at a hip that is stuck externally rotated. Very important that femur can move like it's supposed to. In other structures, particularly the ribs. So understanding this triad provides a useful lens for thinking about health, which is really what we're after. We're driving health delivery. When these domains communicate effectively, the organism adapts well to stress and environmental demands. When communication between them breaks down, the body may drift towards dysfunction, moving from thriving to merely surviving, and sometimes towards failure to thrive. And ideally, that's where we would step in and try to alter that system, try to restore that system, remove the barriers to that system self-regulating and bringing itself back online. So the goal of osteopathic care is to help restore coherence across these systems so that the body can return to its natural capacity for adaptation and regulation. That's what we do. Okay, so neuroendocrine axis, to wrap it up, when you step back and look at everything we've discussed today, something really important starts to come into focus. The body is not operating in isolated systems. It's operating as a coordinated network of signals. And that coordinated signal, it can be really hard to read because it's that entirety of that human. And so it's really useful to be able to see different angles and different levels of that network of signals to be able to say, oh, here's where I see some portion of the signal not working. The hypothalamus is listening, the pituitary is translating, the endocrine system is responding. And in states like pregnancy, the system doesn't just function, it expands. And that tells us something fundamental about human physiology. This system is designed to adapt. If it can't adapt, the person doesn't have the health they need. Now, that adaptability depends on one thing. The signals have to be coherent. When they are, the body regulates, the body coordinates, the body thrives. But when they're not, systems fragment, symptoms emerge, adaptation breaks down, patients don't feel healthy. This is where osteopathic thinking and osteopathic treatment become incredibly relevant because we're not just chasing symptoms. We're working to restore the biomechanical environment, the neural signaling, the chemical regulation, so that the system can come back online as a whole, as an integrated whole that's very adaptable. So thanks for spending some time with us today. I'm Neal O'Neal, here with Brent Mayberry and Brent Mayberry. Thank you guys for being with me. And this is the
Thanks, Neal.
podcast. Yeah, thanks, guys.
All right, thanks. Hey, before we go, I just wanted to say if any of this speaks to you, as either, a practitioner, a clinician, or just a regular person like me, why don't you share this with somebody who needs to hear it? And if you're a clinician, check out Neal's
Come
class
with us to
website.
class.
Yeah, come to class.
Yeah.
I'll link it down below. It's pursuitpt.com/classes. And there are a few more this year, 2026. So check them out. Sign up.
Some really
and
good
come,
ones.
Come learn.
I'm excited for them.
Yeah.
All
All
right,
right, Neal.
cool.
Thanks so much.
All right. Thanks a lot, guys.
All
Thanks,
right,
Neal.
Take care.
See you guys next time.
All right. Bye-bye.
Thanks for joining us on another episode of OsteoSignal with Neal D O'Neal. For more information, please visit pursuitpt.com or pursuitperformancetraining.com. Want to show your support for the podcast? Give us a like, click subscribe, and leave a comment or review. We appreciate it. Our music was written and performed by Sky Toes. Copyright 2026 by Neal D O'Neal.